Hi guys, Dr. Vance here at Denver Sports Medicine. I wanted to show you one of my favorite techniques I love doing with our patients. One of them is what I'm talking about is active release technique of the shoulder, as well as active release, or ARTs, you might hear me say, of the wrist and forearm. So I'm just going to show you a couple simple, easy things that I do to help restore motion, as well as decrease pain and decrease muscle tension in the shoulder and neck area. A common complaint that we will see from a lot of our patients are headaches, especially right now with everything going through this pandemic, is every time to sit, whether they're sitting at their desk, sitting at their table and chairs in their living room or dining room, and then sometimes even in their beds. We're seeing a lot of students that are saying they sit in their bed, causing lots of head and neck pain. So a couple common things that I'll show you is for shoulder pain, we're working through what's called rhomboids. So as our patient, they are going to be actively moving their arm through some motions. Keep going. Great. Come back. And we'll have them repeat that 4, 5, 6 times until we really feel the tissue change back here and we start to really feel the increased mobility of the shoulder. Good. All the way through. Go ahead and tuck that chin down a little bit with it. So with active release, what we're really trying to do is shorten that muscle, and then as she stretches that across, and I'm sitting here holding you with my thumb, not very tight and not very strong. Good. Come back. One more. We're really trying to increase the tension by pinning that knot down underneath my thumb and letting them actively stretch that underneath it to break the knots up. So another common area we'll hit is going to be the back side of the shoulder. So what I'll have her do is here, and she's going to pull her arm across. This is going to be for those really tight posterior shoulder areas. Good. And we'll do one here. And then I'll transition into the wrist and forearm area. We're seeing a lot of carpal tunnel, wrist issues that are being caused because of computer work, not having biomechanical advantage on the desk, having to really sit there. So we're going to work on through her extensors on the outside and flexors are on the inside of her wrist. So we're going to bend your elbow for me, thank you. We're going to shorten that muscle belly. I'm going to pin that down with a little bit of pressure and have her go ahead and flex and then roll your fingers up just like this, and we're going to stretch those forearm muscles. Good, come back, and go ahead, go again. Again, really trying to release this forearm tension, carpal tunnel like I talked about, tennis elbow here. Tennis elbow is just kind of a big term that's used, but obviously there's a lot of other things. Good. I'll do a couple forearm things. So obviously your carpal tunnel's here, so what we're wanting to do is we're wanting to open by spreading the muscles of the hand and wrist, and underneath my hands you can kind of see as I kind of open it, go from closing with my fingers and really trying to open that carpal tunnel. A lot of patients will say how nice this feels on their hands, especially after texting on people's thumbs, writing on computers, gaming in a lot of kids, and sometimes you even get that nice little oscillation and click happening inside the joint. So this is one of my favorite techniques to work on shoulder, neck, wrist, and elbow pain. If you're experiencing that or anything symptoms like this, ART can be a great thing to be able to treat those and be able to get you out of pain. Take care and have a good one.